Good morning. The health insurance. In Switzerland, this name often makes people jump in their daily lives. Some describe it as unfair, others describe it as the best healthcare model in Europe or even in the world. But what is the reality? In Switzerland, everyone living in our country is obliged to join a health insurance company. This law, commonly known as LAMAL or AOS, both abbreviations are used for compulsory health insurance in Switzerland, came into force in 1996. Today, more than 70 insurance companies are operating in our country and sharing the market. Worshipped or criticized, health insurance raises many questions and everyone must be properly informed about the different components. The LAMAL or AOS is the compulsory part of the health insurance system and every single person resident in Switzerland is obliged to subscribe. Each insurance company is thus allowed to charge the premium. This is the most expensive part of the insurance, and the price of the premium is set each year by the OFSP. This abbreviation stands for Office fédéral de la santé publique, which is the Federal Office of Public Health in Switzerland. Take the time to compare the LAMAL with different insurance companies. You will find difference and therefore the possibility to save money. Contrary to popular belief, don't wait until you receive your resident permit to join an health insurance company. A simple certificate of residence issued by the Town Hall or the Cantonal Office of Population, Office cantonal de la population, will allow you to join quickly. Be informed that any person entering Switzerland has 3 months to register with an health insurance company. After this period, important administrative sanction may be applied to the premium. Furthermore, the insured person risks having to pay premiums retroactively, for instance, from the date of registration with the town hall or the cantonal population office, and not being reimbursed for costs incurred as a result of an illness or accident during the entire period in which the person didn't register beforehand. The insurance franchise. Understanding this mechanism is simple. Anyone who accepts a high franchise will have significant reduction in their insurance premium because it will take charge of a higher amount of medical and health expenses. In other words, the higher is your franchise, the more affordable your insurance premium becomes. All insured people have the choice to take the following franchise amount: 300, 500, 1,000, 1,500, 2,000, and 2,500 Swiss francs. If you are healthy, a franchise of 2,500 Swiss francs is highly recommended savings on your premium. This is the first source of savings, and you can save up to 1,700 Swiss francs per year. The quota part. On each invoice you submit to your health insurance company, a 10% co-payment will be withheld by the company from the total amount of the invoice. However, the law provides a maximum amount of 700 Swiss francs which can be applied per year. Some health insurance companies grant a 50% discount from the second child and 75% from the third child. The standard model for the children doesn't apply to a franchise in the insurance. However, some insurance companies agree to apply for a franchise only at your request. Grouping all family members under the same insurance company is also a source of saving. Choosing your doctor within one of the cantonal care network system can also result in savings on your insurance policy, on average between 15 and 17%. Paradoxically, as it may be seen, complementary insurances (LCA) can also be a source of saving. We will introduce you to the 7 most important points where it is essential to draw your attention. Hospitalization, transport by ambulance, rescue, non-listed medication, outpatient ambulatory care abroad, dental care and orthodontics, fitness and wellness. In our country, each canton states has a university hospital of reference, and each of them applies a local tariff price list for the care provided. In practice, this means that if you are admitted to a hospital in your canton of residence, this will not affect the benefit provided by the LAMAN, compulsory health insurance. However, if you are admitted to a hospital in another canton state, you will be charged a different rate and you may feel financially disadvantaged if the rate in the other canton state exceeds those in your home one. To avoid this, make sure you have complementary hospital insurance that covers the difference in practices between the different cantonal hospitals. Most health insurance companies offer this for a few francs per month. An ambulance ride can be extremely expensive in the event of an accident or illness, and can cost between 1,000 and 1,200 Swiss francs when the flashing lights are activated. Furthermore, hospitals are sometimes obliged to move the patient and they call upon ambulances to ensure medical transport without the flashing light, and it costs about 800 Swiss francs. It is important to know these figures because the LAMAL basic insurances only reimburse 50% of your transport, with a maximum limit of 500 francs per year. Suitable complementary insurance will save you expenses that could be easily avoided because it will take care of a large part of the cost generated by medical transport or ambulance transport. The basic health insurance (LAMAL) covers up to 50% of the cost incurred, up to a maximum of 5,000 per year, and only in Swiss territory. Rescue means all action taken to save someone from danger due to his or her state of health and/or critical location in order to prevent his or her state of health from worsening rapidly and endangering his or her life. However, the cost of such and rescue are not covered, which is why you should take out complementary insurance to avoid financial cost of several thousand francs. Important to know, the intervention of a helicopter costs on average 200 francs per minute. Basic health insurance (LAMAL) covers all medications on the list of specialties (LS). The list is established and maintained by the Federal Office of Public Health (OFSP) and includes medication authorized by Swissmedic, which are considered effective, appropriate, and economical. However, there is a list of medication that are not reimbursed by basic health insurance. These are non-listed medications whose preparation are authorized for sale in Switzerland by Swissmedic, but which do not appear on any list, neither in the LS nor in the LPPA. They are only reimbursed by complementary insurance based on a doctor prescription. Outpatient care is the diagnosis, treatment, and follow-up of a patient without hospitalization. It can be, for example, a treatment in the emergency room, a medical consultation, an alternative medicine treatment, or help at home. The complementary insurance of ambulatory care cover expenses not reimbursed by the basic health insurance, and ideally supplement the legal benefits, often limited. Furthermore, it will allow you to relieve efficiently all your relatives and to continue your treatment serenely. Basic health insurance (LAMAL) only covers dental treatment if it is caused by a serious illness or an accident. But the LAMAL insurance doesn't cover any routine dental treatment. Treatment of cavities, annual checkups, scaling, common dental problem, orthodontics, implants, root canal treatment, tooth scroll. If you want to be reimbursed for some of these services, you need to take out supplementary insurance. There are supplementary insurance that help your children to have dental care from a young age. Fitness and wellness. Physical activity is a fundamental need of your body, but with our modern lifestyle, we often don't do enough. We spend a lot of time sitting down and don't work much. From now on, move more every day. It is worth it. When you do a lot of physical activity, you are less affected by illness until old age, and you simply feel better. Additional insurance will help you get a partial refund on your fitness membership. Here is another way to consider saving money. We have concluded our presentation. I hope it helps you to better understand how to read your health insurance policy and to think about possible savings. I thank you for your kind attention and invite you to put a like if you like the video and subscribe to my YouTube channel if you would like to receive more tips regarding your insurance. If you wish personal advice, I invite you to click on the link in the description or to write me at my email address. You can also reach me by phone. See you soon.